Hi, my name is Dr. Molly Decker. I am a breast surgeon at Banner MD Anderson in Northern Colorado. I originally grew up in Iowa, and so I went to undergrad, and then I also went to medical school in Iowa at Des Moines University. Then trained with residency also in Iowa, moved out here to follow family. My sister and her kids live in Denver, and so I wanted to be near them, and that's how I ended up here. I've been here ever since. My mother was diagnosed with cancer and went through a variety of treatments until she sadly passed away. Going through that experience really impacted my pathway and what I decided I wanted to do with my life.
What brought me to Banner MD Anderson was I had a routine mammogram. So I did a biopsy that came back as a stage 2A breast cancer. So it kind of changed a lot of things for me, and I got that diagnosis December 1st of 2023. I met Molly Decker on the first consult. She was very warm and welcoming when I first met her. She was very informative, always checking for my understanding. Everybody else kept telling me, you know, you're in a good spot and we're gonna get this cancer. And then she gave me all the instructions way ahead of time. And then when I came in for the pre-op, it was like, well, here, let's just go over this again. And so I felt very informed. And it was about 4 weeks of recovery.
So Tricia got her routine mammogram. She came to our multidisciplinary clinic where we were able to meet with her, not just the surgeon, but also the medical oncologists and the radiation oncologists and genetics, and customize that care to what she felt she needed most at that time. Coming up with her treatment plan based on her cancer, we did end up starting with chemotherapy. If we just go straight to surgery with some tumors, there is more of a leaning towards a mastectomy when the tumor is quite large. And in this case, we're able to shrink things down so that when she does choose her surgery, that is one option. It is so crucial for women to get their screening mammograms. It is a phenomenal tool that we are able to use to be able to catch cancer early, sometimes even in a stage where it's pre-cancer. It's so common that there are no symptoms when breast cancer is diagnosed. So there's no lump, there's no pain, nothing. It's just a screening mammogram that identifies it, which just really emphasizes the importance of being able to utilize those screening tools so that we can catch things early.
I tell everybody and anybody, don't skip your mammograms, don't skip your annual exams. I would say it probably saved my life because I had a HER2 positive, which is a very fast replicating cancer. So if I would have waited a whole lot longer, my stage would have been a lot higher.
At Banner MD Anderson, we have the unique opportunity to be able to offer comprehensive care, and having those at our fingertips for when it's appropriate for the patient has been crucial. It's also been a breath of fresh air to be able to offer clinical trials that are on the cutting edge of what the next approach is going to be for cancer care. One aspect I really like about the Banner MD Anderson program is the connection to Houston and MD Anderson, and we are able to interact with their specialists to get that additional layer of innovation and ensuring that we are staying on the cutting edge approach to all of our oncology care.
I am very thankful for Banner MD Anderson. They are known across the nation as a great cancer care center. So I am very grateful for them being in the area. They're not based out of Colorado, but they're making their name known here and they're doing great things.
I truly have the best job in the best community. The people here are incredible, and the strength that I see in the women from day one throughout until afterwards, it inspires me truly to be a better person in my life, and I feel so fortunate to be able to be a part of this community and their care.